Good morning, everyone, and thank you for joining me today. My name is Eder Fernando Martinez Guerrero, and I'm pleased to present this short talk on patient safety and oral surgery, a topic that is essential for every dental professional. Patient safety is one of the main pillars of modern dentistry, with the constant innovation of new materials, techniques, and medications. Our treatments have become more complex, and as a result, the risks for our patients have also increased. Studies have shown that most adverse events in dentistry are linked to drug administration and surgical procedures. However, the greatest problem we face is not just the presence of these events, but the lack of a sufficient database that clearly defines their causes, frequency, and consequences. Without this information, it becomes difficult to create effective protocols and preventive measures. That is why understanding and preventing adverse events is fundamental to ensuring patient safety in our daily practice. Oral surgery is one of the most delicate and demanding areas of dentistry. It involves working with soft tissues, bone, blood vessels, and nerves, all in a very small and complex space. In this context, patient safety is not just about avoiding mistakes, it's about being prepared, knowing how to identify possible complications in advance, prevent them, and act quickly if something goes wrong. Unfortunately, Unfortunately, many professionals focus mainly on perfecting the surgical technique itself and overlook the early identifications of potential risk. This ignorance creates a dangerous gap, and that gap is that truly threatens patient safety. And what can we do to improve safety? Well, the answer begins before the surgery even starts, with a complete medical record. A thorough preoperative evaluations allow us to identify risk factors such as diabetes, hypertension, allergies, or bleeding disorders. It's essential to take a detailed medical and pharmacological history, ask about anticoagulants, and request laboratory tests or X-rays when necessary. This process allows us to adapt our surgical plan to each individual patient, and that is the foundation of safe clinical practice. Another key factor is continuous professional development. Oral surgery evolves rapidly, and techniques, instruments, and safety standards change over time. Dentists must keep updating their knowledge through courses, workshops, and advanced diplomas. We should be trained not only to perform the surgery, but also to manage intraoperative and postoperative complications. Staying up to date with scientific literature help us apply evidence-based practices that keep our patients safe. Of course, patient safety also depends in the clinical environment. Following biosafety and asepsis protocols is absolutely necessary to prevent infections and other complications. Simple but vital measures, such as proper hand washing, disinfection of instruments, correct use of gloves, masks, and protective eyewear, and ensuring a clean and ventilated surgical area. These make a significant difference in outcomes. Safety doesn't just come from skill, but from discipline and teamwork. To conclude, improving patients' safety in oral surgery doesn't mean eliminating all risk, because risk will always exist. Instead, it means recognizing, preventing, and managing them effectively. The key to safer dentistry can be summarized in three words: prevention, preparation, and communication. When we base our practice on evidence, follow protocols consistently, and maintaining an ethical and responsible attitude, we can reduce adverse events and offer care that is not only safer, but also more human and of higher quality. Thank you very much for your attention.